The best healthcare system in the world? Not in Canada. Expensive, lengthy waits, doctor shortages, old medical technology. A new report from the Fraser Institute puts Canada's healthcare system on the examining table on this edition of Fraser TV. Hello, I'm Leah Costello. Many Canadians like to believe that we have the best healthcare system in the world. But a new Fraser Institute study that compares the Canadian healthcare system to universal access systems in other industrialized nations shows that Canada just doesn't measure up. The study finds that on an age-adjusted basis, Canada spends more money on healthcare than any industrialized nation except Iceland and Switzerland. Yet, Canada ranks near the bottom in terms of access to doctors and new medical technology. For example, with only 2.3 doctors for every 1,000 patients, we're 23rd out of 28 countries. We were second back in the 1970s when public medical insurance was first implemented.
It is incredibly difficult in Canada to find a family physician or a regular physician. Statistics Canada has, of course, shown in a number of surveys now over the last few years that many Canadians simply cannot find a family physician. And the medical associations and groups of practitioners have said very much the same thing.
And that leads to long waiting times, something some doctors say is unacceptable.
Waiting for healthcare leads to deterioration.
Among the countries studied, Canada is the only one that outlaws privately funded purchase of core healthcare services. Under our laws, only the government can provide healthcare insurance.
The Canadian healthcare system, compared to other developed nations' universal access health insurance programs, is remarkably expensive. In fact, it's the developed world's second most expensive universal access health insurance program. And yet, for all of that money, Canadians receive relatively poor access to physicians and medical technologies. They receive some of the longest waiting lists in the developed world, and satisfactory but not great outcomes from healthcare.
So what's the answer? The research says Canada needs to reorganize its healthcare system to allow greater involvement by the private sector. Not an American-style system, but a blend of public and private like those found in many European countries.
When you look at the developed world's most successful universal access health insurance programs, and that's either those systems that are better than Canada's in terms of healthcare outcomes while spending less money than Canada does, or those 7 nations that have no waiting lists for access to the health insurance system, you find in every last one of those nations cost sharing for publicly funded services. Patients are responsible for some of the costs of the care they consume when they enter the healthcare system, so they're encouraged to make a more informed decision about when and where it's best to access the healthcare system. You find private competition in the delivery of publicly funded services, a competitive hospital sector, and finally you find a private parallel healthcare insurance sector. People have a choice between who's going to pay for and who's going to deliver that health care.
The report concludes that overall, Canada's healthcare system is inferior to the universal access systems found in other industrialized nations. You can see how Canada compares to other countries in the complete report, How Good is Canadian Healthcare?, available at fraserinstitute.org. We've also been receiving a lot of positive feedback on our recent conversation with Dr. Brian Day, former head of the Canadian Medical Association, also available online at www.fraserinstitute.org/FraserTV. And that is all for this edition of Fraser TV. I'm Leah Costello. Thanks for tuning in.